Good morning. Thank you for the opportunity. This time, I would like to present a case report with the title Non-tuberculous mycobacterial meningitis infection in HIV patient. First, I would like to introduce myself. My name is dayusatriani. I'm a resident of Clinical Pathology, Faculty of Medicine, University of Indonesia. My mentor is Yusuf Bahasoan, clinical pathologist and Bachelor of Medical Science at my institution. Non-tuberculous mycobacterium or NTM is an opportunistic pathogen in susceptible cases as an immunodeficiency state. This case report is intended to give further knowledge and spectrum of clinical and laboratory aspects of this very complex and rare case. A 38-year-old male suffered from immunodeficiency condition due to HIV/AIDS, causing opportunistic NTM infection, accompanied by AML, which also exacerbates immunodeficiency. Patient also suffered from hospital-acquired pneumonia and had hepatitis B and C chronic co-infection. Centers for Disease Control and Prevention, or CDC, reported that NTM infection could be found in 10% of patients with HIV, presenting with symptoms resembling MTB, to such an extent that NTM infection could be suspected in cases unresponsive to anti-tuberculosis. NTM infection may progress due to therapy inadequacy and could disseminate mostly hematogenous to other organs, such as central nervous system. Case: a 38-year-old male on admission with fever, suppurative cough, dyspnea, headache, and altered consciousness. He had history of HIV infection on antiretroviral therapy since 2008. He suffered from hepatitis B and C co-infection since 2017 and was diagnosed for AML in 2019. The patient subsequently diagnosed as AFP-negative tuberculosis and been treated with anti-tuberculosis regimen since April 2020. He fell in non-donors category and the physical examination showed oral candidiasis, rhonchi, and liver enlargement, but there was no sign of meningeal irritation. We did not recover any bacteria for acid fast and gram stain examination, and NTM was detected based on PCR-TB CSF analysis. AFP stain was negative for sputum specimen, and there were no improvement on radiologic imaging, suggested NTM infection on central nervous system from pulmonary origin. Enterococcus faecalis and Staphylococcus saprophyticus found in CSF culture is the most likely contaminant because recollection from the data were not supported for bacterial infection. Gram stain and sputum culture recovered Klebsiella pneumonia and Pseudomonas aeruginosa, suited with healthcare-associated infection pathogen, and also supported by an increase of procalcitonin level, radiology imaging, and physical manifestation. We recommend the selection of antimicrobial therapy refers to the susceptibility test. Histology of bone marrow biopsy was concluded for AML, and patient had elevated blood peripheral percentage more than 20% with anemia and thrombocytopenia. The patient was diagnosed from hepatitis B and C co-infections, and hepatitis C viral load indicated that their sustained viral response was not accomplished. His CD4 cell count showed mild deficiency on advanced HIV stadium, consistent with wasting syndrome, NTM opportunistic infection, and oral candidiasis. Those indicated chance of HIV treatment failure, so we suggested viral load HIV test to assess ART suppression of viral replication ability. We suggest fecal analysis due to assessment of diarrhea and or to provide further information about patient's GI tract condition. And we also suggest blood gas and electrolyte analysis for clinical assessment. Thank you.